All right, we are currently live. And then I'm just gonna give it a minute or two and then I'll start. Hello and welcome everyone. Today, Dr. Ben Horning, a chiropractor, will be speaking to us today. And if you have any questions, please put them in the chat and then the link to the Google Forms will be posted at the end of the session. So give it up for Dr. Ben Horning.
Hi, everybody. Thanks so much for having me. I'm excited to talk a little bit about what I do and chiropractic, and I'm here to answer any questions you guys may have. Yeah, I'm excited to do this thing. So I'll start by sharing my screen here, and let me just get this PowerPoint slide going. That's me, Dr. Ben Horning. I'm a chiropractor here in Orange County, California, specifically Laguna Hills. Okay. Good. Okay, so what is it like to be a medical professional in my field? Well, it's interesting. As a chiropractor, there's just so many cool aspects to what we do. It's not always just cracking bones or posture, but it's holistic health. It's improving the entire body. And we do it with chiropractic, but we could also do much more. We could recommend exercises. We can recommend nutrition, herbs, supplements, lifestyle changes, things like that, to help the body really heal itself. And it's a beautiful thing. It's very rewarding though, because a lot of times you could just help somebody with one visit, and with your bare hands you could get somebody out of pain, or you could get them to do a lot better within even 15 or 20 minutes. And sometimes these are conditions people have been struggling with for months or weeks, and in some special cases, even years. So it's very, very, very rewarding. I don't know exactly where I heard it, but I think chiropractors are one of the top doctors for like happiness. I think chiropractors are some of the happiest doctors. We're not necessarily dealing with depression or like life and death situations, although pain can be very debilitating. It's a beautiful thing because a lot of times we'll treat people and get them out of pain. And then on the other aspect, there'll be patients that just want to feel better or just want to improve their life. So you can get them to like be out of pain, and then you can get them to a position where they can even function better. When you do adjustments, you help the body's nervous system. So there's so much more potential a person can reach when their nervous system works better that they might not even be aware of. So being a chiropractor and helping people develop uh, into healthier people is very, very rewarding. So we run into, at least in my practice, people that are just very proactive in their health. And they'll come in maybe once or twice a month. I'll see bodybuilders or weightlifters, and they'll come in to get treated not just for injuries, but if their nervous system works better, they live stronger, you know. Or I'll have professional athletes or collegiate athletes or high school athletes that come in just to give them that extra edge. And that's a beautiful thing because you can help somebody live their dreams or their goals better. And it's not just find out what's wrong with you, but it can also be how can we make things even better for you? So as a profession, there's both sides of the coin. There's the side where you're getting somebody out of pain and getting them to uh, get back to where they were. And then you can really just get somebody to even thrive even more. I mean, cervical adjustments, adjustments in the neck really can help the brainstem and get certain synapses to fire even better. Um, so it's a beautiful thing. And I absolutely cannot see myself doing anything else. I think when it comes to prescribing drugs and medications, they have their place, but sometimes people get overly prescribed things or they get prescribed things that they might not necessarily need. Um, and with chiropractic, a lot of the times you can find core issues that can be resolved without drugs or surgery, or to prevent somebody to have to get those things. And to be able to do that with your bare hands, or to be there one-on-one with the patient and be with them every step of the way from when they're really in trouble to when they really thrive, it's amazing. And I highly recommend it, especially if somebody's interested in something like this. Okay, what I find most interesting, this is just my perception on it. There's a lot of things when you deal with anatomy and the physiological components of a person to get them to improve. But it's actually, I mean, I've been doing this for about 8 or 9 years now, and I could look at a person and look at their attitude, and I'll know if they're going to get better faster or if it's going to take a lot longer just by how they approach their own health. And that seems to be just an interesting component, that psychosocial emotional component to it, where like if a patient comes in and they're ready to do whatever they want to do to get better, they'll listen to you, but they get better. If they want to get better, even if it's not with me, if it's with a physical therapist or a medical doctor or an orthopedic, you just see it. Like if they want to get better, they get better more often than not. Now, is that everybody? No, but I do see that fairly often. And then I'll find the patients that are very skeptical, where you have to prove every little thing to them. And they're not sure. And before we do this, let me do some more research on this, and let me do another write up, and then let me look into this, and then maybe we'll do it, and maybe we won't do it, but maybe we will do it. And they're kind of stuck in a maybe. It takes forever. And even if you do every little step that's absolutely correct, there's a component to that. And I kind of was wondering why that is. And it might be something to do with a placebo effect. And a lot of times the placebo effect might have like a bad connotation to it. But if somebody's taking like a sugar pill and they get better, then obviously the mind has a component to that. But there's an opposite to that. It's called the nocebo effect, where if somebody feels like they won't get better, or they won't improve, or nothing's going to get them feeling better, it works in the opposite. So I think that's probably one of the most interesting things is the patient's attitude to that. And if you're going to get into the healthcare field, you should be a people person, in my opinion, or at least in my field, because you can talk to the individual and you can really get to the real reason why they're there. And you'll find sometimes they come in for, at least in my case, somebody might come in saying they have back pain, but it's really a headache they've had for a while. And being able to dig in and finding out what's the real cause for it, and then the motivations for somebody to get better. That's a big component to it. And to add on top of that, like sometimes they'll find like a mom and daughter or husband and wife where like the parent or the spouse wants the other person to get better. But if that patient doesn't have that same motivation or they're getting dragged to do it, it takes longer. Do they not get better? That's not always the case. A lot of times they do get better. It's just more of a timing thing. Like the guys or girls that'll just go all in and really um, put their health first and really are motivated to do it, they improve. And I don't know if that's necessarily a chiropractic thing, but just as a doctor, um, just an interesting thing I've noticed. Okay, let's go to the next thing. Case study. Yeah, this is a fun one. And I'll explain the whole study and then I'll go over more about it. And then I kind of want to talk about this because I prevented somebody from getting an unnecessary surgery on this. Pretty much what it was a 64-year-old woman who presented with left side sciatica. And if you guys don't know what sciatica is, it's pain that either comes from the low back or the glute region, specifically the piriformis. And it's sharp pain that goes all the way down the leg. And it can be excruciatingly painful. Like if you haven't experienced it, be happy if you haven't experienced it because it's not fun. And so she had it, and she had it for a while. So she went to her ortho, and they did an MRI, and she had a 4 millimeter disc bulge in her L5S1 region, which is like the lower part of the back, right above the sacrum. It's like that in between spot, and it's one of the more common areas to get a disc bulge. And yeah, the ortho went into just straight go into surgery for this, but she just didn't. She felt like he was being a little too pushy with it, and she wanted a second opinion. And yeah, I'm glad she came to see me. And we did orthos and neuros on it. And like I said, sciatica comes from the back, and it comes from an area in the butt called the piriformis. And in her situation, all the orthos and neuros showed up where it was more from the piriformis than the lower back, which was interesting because she had the disc bulge, you know? So I decided let's not even deal with the low back on this. Let's just see what happens if we treat the piriformis. If I treat the piriformis and just hold off on the low back in general and see if there's any improvement. Because if it's coming straight from the low back, there probably won't be any. But if she's failing all my orthos and neuros on the piriformis, maybe there's something to this. So I did some chiropractic treatment on that. I did soft tissue work. I think I did cupping, kinesiotaping, active release technique, myofascial release technique, stuff like that. She got better in the first visit. It wasn't like 100%, but it was pretty significant. So I sat and I looked at it, and I've seen a ton of MRIs. And one of the things I think people need to know is like MRIs aren't like the end all be all. Like patients think they are. Like if you have one bad MRI, they think that like, that's it. Like, this is all it is. But occasionally, if you do like a MRI on a person and you do it 1 month and then the next month and then the next month, sometimes people will show up with disc bulges and then sometimes they just disappear and there was no symptoms in between. And they're just like incidental or idiopathic things. And in her situation, that's what actually happened. She had an incidental disc bulge with symptoms of something that that disc bulge would produce. But it wasn't coming from the disc, it was actually coming from the piriformis. I think it took me about a month of just working the piriformis muscle and working on that whole sciatic nerve issue, and it went away. But she went back to, I mean, she felt great. And but it's always good to do your due diligence, especially if you did have a disc bulge. And so that's what happened. She came back to her ortho and did another MRI, and the disc bulge wasn't there. And so it was an incidental thing. It was an incidental disc bulge that in most other situations would cause that type of sciatica. But it's important to do orthopedics and neuros and look at the case and not just go with what one MRI says. Like you have to look at it, you know? So in that situation, that's what it was. It was something called piriformis syndrome. And the result, her sciatica went away and she did amazing after that. She still comes in from time to time just for wellness care. Sometimes we do those or like wellness checks. And she avoided getting surgery, which is like awesome because that would have taken forever. You still might have even had the same issue, you know, because it wasn't even coming from that area. So yeah, so if you get into the health field, like just look at every aspect of the case and see if things add up or they don't add up. Because sometimes you'll get something that's textbook this, but in real life doesn't present like that. And then in other cases, you'll run into things that kind of look messy and you'd have to do some trial and error. Like for example, she didn't do well on the piriformis neuros and orthos. So I decided to just treat that and see if it got better. And say it didn't get better, okay, maybe it was coming from the low back. But the fact that it was improving was an indicator that there's more to this than just the dispatch. So yeah, that's my first case study. I wanted to just touch on one or two more things. I don't think this was the patient, but this is something I think is important just for people to know, especially if you're in the healthcare industry. You you gotta see if things make sense with patients, because sometimes when patients see other doctors, it doesn't add up, and you would just need to look at what they did, but then also look at it on your own determinism to see if it makes sense or not. And I could probably go into more of that in detail a little bit later, but sometimes other doctors make mistakes, and sometimes other doctors can be a little corrupt, and sometimes people get unnecessary things done. So if you can get everything from all aspects of the person's file and just get the data from the person, and sometimes the patient knows better than the doctor does. So you need to like listen no matter what, instead of just going off reports and things like that. And at the end of the day, you're helping people, and these reports are tools, but you need to talk to the patients as well. Because I've had it where patients will tell me like a doctor spent less than 2 minutes with them and then wrote them this prescription and then wrote them this, and then sometimes they don't always jive. So when you become the doctor, just listen to the patient. Okay. I felt like it kind of went off on a little rant there, but I'll get back onto this. Cool. Case study number 2. Okay, 23-year-old woman presented with migraines, and she had them 3 times a week. Her vitals and history were unremarkable. Just for some people that may not be in the healthcare field yet, unremarkable is a depressing term that we use for things like fine, or there's no real issues. I don't think you could say things look good, so we use the word unremarkable. So there weren't any like red flags when I did her vitals or we looked into the history of her. She presented with anterior head carriage, which means the head's like forward, you know. rounded shoulders like this. And then a lot of times when you assess somebody's posture, there are, especially if there's like headaches involved, the jaw can be involved. And so she presented with what's called a C curve, TMJ dysfunction. And it deviated to the left with no clicking, which means when she opens her mouth, it would do like a C curve. A lot of times that's like a muscle issue, where like an S curve, which might look like this, like then we're dealing more structural with like the discs in the jaw. So she had like a C curve, and it was deviating to the left, and there wasn't any clicking. Dermatomes and myotomes were unremarkable. And if anybody doesn't know what those are, the dermatomes are like sensory patterns that come from the spine, and uh, different levels of the vertebra will present differently in like arms and legs. And myotomes are muscles related to certain nerve patterns coming from the spines as well. So when those show up, then we're looking at specific issues. But for her, those were totally fine. Her cervical range of motion was restricted. So when she looked left and right, up, down, side to side, it wasn't like a full range of motion. And yeah, so that's kind of like the situation. So she had migraines. I don't think I had this on, but she was taking Advil like constantly, which I mean, if you're taking Advil all the time, it can affect things internally, like your liver and things like that. So yeah, she was dealing with this, and she was taking the medication for it, or at least the Advil for it. So I did like a chiropractic protocol, and this involved adjusting her posture. I adjusted her neck and mid back, and then I worked on some muscles in her mouth and jaw, the pterygoid muscles inside, as well as the temporalis muscles, and something called neuromuscular re-education. It's kind of a fancy word, but it's a way to re-educate the muscles and make them work properly. And so after doing that for, I think for her it was like a 2 or 3 month program. I mean, she was pretty bad off. But after doing that, her posture drastically improved, and her mandible motion, which is the jaw, was completely fine, and no migraines. They were gone. And so the main takeaway was the posture. Her posture was affecting her health and making her take these migraine medications. And she didn't have to do that. You know what I mean? Like she was taking all these meds, but it really wasn't solving like the underlying condition, which was her posture. And by being able to improve her posture and work on the jaw as well, and getting things properly aligned and opened up, she doesn't need to take Advil anymore, and the migraines are gone. Anybody that's experienced migraines, like they're not fun, and they can prevent you from living your life. Like if you want to go out and hang out with your friends, but you can't because you have a migraine, or you have to miss an important event in your life because you have a migraine. I mean, it can prevent you from really like living, and if you're addicted to taking like Advil, like that's not really solving the issue. So with her, it was a posture thing. And what I see a lot of the times with, I guess, like the Gen Z guys, even younger, and like even millennials and stuff, is being on your phone all the time or being in front of the computer all the time. You go through puberty. And if you're going through puberty and the bones are growing and you're going with poor posture, you're setting yourself up for failure. So always working on your posture can help. It can help with your jaw. It can help with headaches. And your body just does better with proper posture. So the chiropractor, we're always looking at it. It's just, I do kind of feel for some of you guys because it seems like life is now on your phone and computers and stuff like that. And I'm not here to make you guys wrong. I'm always doing stuff on my phone like computers. But if you do proper stretching and you open up the chest and you do work on your posture, you're probably going to be better off. Okay, advice for prospective healthcare professionals. Yeah, this is kind of like important. It's about people. You need to love your patients, and you need to be the person they can trust. And you have to be able to think for yourself and learn all aspects of your craft. Because if you do what I do, I mean, I'm seeing people all the time. I mean, I can't tell you how many people I see a month, but it's a lot. And if you're not in it to like really help people, if you're in it for the wrong reasons, like you want to just make money or you want to own your own business or you just want the title of being called a doctor, um, I mean, school is way too long. It's way too expensive just for something like that. If you do it to really help people, there's so much more meaning and love and compassion and meaning to your life, and you do better. Like if you care about people, you do better. Um, and I would say, as a doctor, you should want to care about people, and it should come from all walks of life. It doesn't really matter. But by putting that into your care, you'll be better as a doctor. And then the other thing is learn everything in your field. When I was in chiropractic school, they told me learn one or two like specific techniques and be the master of that technique. I think that's probably some of the worst advice because I see people from all walks of life. I get people that are afraid to get cracked. We have adjustment tools, which are specific techniques that do it. That it's like a low impact. It's super. It's not scary. I have patients that need to be on wedges. I have patients that need to use drop cable. I have patients that need to do muscle work or TMJ work. Um, and you need to know these things. And sometimes they don't teach you all of this stuff in school and you have to learn it on outside seminars, but do it. And if you're doing it in school, like that's probably the best because once you're out in the real world, you have to worry about real life stuff. But when you're in that period of like purity of just becoming a better doctor, that's when you should go out and learn every technique and everything about different things, nutrition, neurology, things like that. Because it's going to come your way. And sometimes people don't want to see anybody else. They just want to see you. And you have to be able to produce some sort of results or be able to help them. Uh, I don't recommend being the person to do everything, but and definitely refer out when you need to, but don't be closed-minded on things just because of inconvenience. It's a good idea to learn everything you can so you can be the best doctor you can. Okay, let's see the next slide. Yeah, so I think I kind of went into this a little bit before, but yeah, make sure you're just doing it for the right reasons. For a sec. Can you guys still see me? Is it still sharing? Let's just get back to the slideshow. There we go. Okay. Yeah, so just make sure you guys get into the right reasons because people do depend on you. And you're going to run into nice ones, mean ones, different ones, bored ones, panicky ones, like all sorts of personalities. Uh, so pretty much humanity. You're going to run into all aspects of people. You're going to run into conservatives and liberals and people that are anti-vax and people that are pro-vax and people that are like literally everything. And regardless of where you stand on things, like you just have to be there for the person. Like they're there to see you, and you want to help. You want to help people, and you want to do it in like a caring way where you're not. You're obviously the authority figure, but you're also approachable. Because I used to do the whole thing where I would wear like the white coat and the tie. I think it was because I was a young doctor. I just wanted to be respected, and I wanted people to just. I kind of kept it very cold, but patients wouldn't tell me things that were like important to their case. And I found, I mean, if you want to wear a white coat, cool. If you want to wear a tie, that's fine. I mean, I don't dress down. I'm not wearing a t-shirt or anything like that, but dress somewhat professional. But be approachable because people will tell you things that's critical to their case if they trust you. And if they don't trust you and you're very cold, you're not going to get the data to make the right decisions to make them feel better. Um, you're going to see it all. You're going to see people that you 100% don't agree with and people that you agree with 100%. And just try your best to help everybody. And some people are going to listen to you. Some people aren't going to listen to you. But just approach it as doing the right thing, and caring about people. You'll be better a doctor. Um, but if you're like the type of person that you get really upset at people, or you're afraid to even communicate to a person, or look somebody in the eye, and people get under your skin, you're gonna have a harder time. At least in what I do. You could do other fields, where it might not be direct, but I mean, this is a profession where you're dealing with humanity, and you want to improve humanity with your services. So just be patient, be very caring, be effective, and deliver quality healthcare. That's kind of like my advice on that. So I think what I want to do now is there's probably a bunch of questions. I'm going to stop sharing this and we can answer some of them. Does that sound good? Cool. Let me just see. There's a lot of them. Yeah. So one of the questions here is, what inspired you to be a chiropractor? Or is it something that you suddenly went into? And how did you treat adults and children differently if you treat minors? Yeah, those are good questions. I'm a second generation chiropractor, so my father did it. And growing up, I would just see people who they were told never get better, and then saw the chiropractor. And I think we have a better name now, but back then, chiropractors, there were certain stigmas about them. And so, but he would see that people, I would just see patients see them and just get better. And I thought, well, I'm going to do that too. And when it comes to how do you treat adults and children's differently, I think, I mean, you want to treat people like people. Sometimes kids are a little bit more mature than they should be by that age. So I wouldn't necessarily talk down to them. Um, I usually have the parents in the room, and I would talk to the kid as the person. And if they don't give me proper answers, or if they're having like a hard time, or especially if it's like a real young kid, obviously talk to the parents too. Just involve everybody, like have it as like a family chat. But I wouldn't ignore the kid. Like I wouldn't just talk to mom and dad and pretend the kid's not there. So that's not a good approach either. So just talk to the kids as well. Talk to the parents and just have them all in the same room, and it should be fine. Kids do great with adjustments now. They love it. Sometimes they say, I've been called Dr. Dinosaur because we have a lot of skeletons here. Um, I can't wait to get my popcorn. They call it getting popcorn, things like that. But they love it. It's cool. I love helping them. Okay, what's the hardest part of being a chiropractor? And what measures are taken when manipulating the spine to ensure no harm is done? Okay, yeah, these are good questions. Um, Hardest part, I think it's actually, as a chiropractor, that's a good question. I think it's getting started as a chiropractor, personally. I was like one of the top of my class, and I got a scholarship while I was in school and stuff like that. Then I graduate and I start practice on my own. And I remember people were like, "Oh, I hear you're a chiropractor. How long have you been in practice?" And I'd say something like, "Oh, 2 weeks." And they're like, "Oh, 2 weeks, great." Nope, you know. So it's kind of like hard to get started. I did like a networking group where they really helped build me up. It was like a group where it was one profession per member. The group I was in was BNI, which is Business Network International, but there are a bunch of them. That kind of helped get it going. I think as a chiropractor, yeah, just getting started. I think that's also for any person that's not joining like a group practice. What measures are taken when manipulating the spine to ensure no harm? Well, just so you know, the training's crazy. Like you really practice it. It's not like you don't know what you're doing by the time you graduate. I mean, you've adjusted like a ton of people. Um, the basics of it pretty much are, you want to. It's like you don't want to adjust too slow. With the neck, you don't want the neck in extension. This is usually where people run into trouble with neck adjustments, is the neck's in extension. When you see somebody get adjusted, it's usually in neutral or inflection. And then just getting the proper depth and speed with it. Um, it's a thing that just takes practice. It's kind of like a sport. It's kind of interesting. It's like on one aspect, you have to be very smart and you have to know all the medical stuff that's going on. And then the other aspect is it's kind of like a sport too, where you have to train to get it good. The ones that don't adjust well, they're hesitant. They're very hesitant and they don't lock the patients out. When you do adjustments, there's a certain lockout where if it's the low back, you'll feel it, and it's like you have like this much room when you move the leg to get the lockout, or with the neck, it's a very specific feeling you get, and that's where you do it. Sometimes if a doctor doesn't lock the patient out specifically, that's where they can run into issues. Or if somebody's too inflamed. Like if they're too swollen or too like, you would probably want to bring down the inflammation first before you do those type of adjustments, or do softer adjustments. You know? That's kind of the best thing. If they're failing your ortho, I mean, also make sure you do exams. Like you don't want to just adjust the stranger. Like do all the exams to make sure they qualify. Like patients should qualify for them. If you've seen some of my like videos on social media and stuff, like all those people are well qualified. Like we don't show that stuff, but I'm not going to adjust anybody that's not that presents with red flags. And if they need imaging, they get imaging first. You know, that's kind of how you should do it. Okay, what are common reasons for hesitation you think takes people a while to approach a chiropractor? And how often do patients whose pain is mostly and sufficiently mental, not physical, how often do you get those? All right, yeah, those are good questions too. Common reasons for hesitation that you think people, I don't know. I mean, there's a lot of black PR out there. I think the American Medical Association lost a lawsuit for conspiracy to destroy the chiropractic profession. I think that was in the 90s. So they took that out of the textbooks. Like for a while, chiropractors and medical doctors, we were called quacks and we were in their like textbooks. And then there's a Supreme Court case where it was like a full-on conspiracy thing, I think. And they lost. And so that's out of the textbook. So a lot of the black propaganda or like black PR really isn't there. And we work great with medical doctors. Like I refer them, they refer me, and we do good. You know, it's fine. But I think the sounds, the crack sounds, can make people a little scared. They think like we're breaking somebody's neck. It's just a gas bubble. It's just opening up the joint, and it's like a suction, and it comes back every 30 minutes. So that isn't the adjustment. It's just like a side effect. When I do my videos, it sounds louder on film than it does in real life. And we don't even use the microphone. I think it's just the acoustics. So I think when people see that, maybe they get hesitant on it. But once they come in and they see what it's about and they get adjusted, and they see the adjustments aren't like this really big scary thing, that hesitation typically goes away. I think mental has something to do with it for a lot of people. I'm not going to say everything. Like if you get into a car accident, that's not you making that up, you know, but I do think there's a little bit of a component to it, and it's more, I wouldn't necessarily say the pain is all in their head, but how fast you heal can be approached by that. Like I've had two patients, like say it was like a sciatic issue, and two patients with the same issue, the same misalignments, but one's like gung ho to get better, and the other doesn't know why they're being dragged here. The one that's gung ho is going to get better. I could almost guarantee that. Can't say anything 100%. You'll find in the healthcare profession you can never say 100% on anything. You always have to be somewhat vague, but I do see that more often. Okay, two questions. What are some common myths you hear about chiropractors? I mean, there's a ton of them. And what is the most interesting case you dealt with? I think the case studies are kind of some interesting ones. I could tell you a really cool one. Common myths, we're quacks, we're not real doctors, we're fake, muscle tests aren't real, the sound, like, I don't know, there's like a billion of them, but there's things for everything. Like pharmacists get made fun of. I mean, dentists, like, oh my gosh, like there's so many, like, whatever. Don't let that bother you. If you want to be a chiropractor, the people that come into your office already want to get chiropractic care. And I wouldn't try to go out of your way to prove what you do, because it's just going to be a back and forth. And then even if you get the guy in, there's still going to be it's a hard road to go down. Just focus on the ones that want to get better, and then they'll tell their friends. And if they want to get better, cool. But if you're gonna nitpick back and forth with somebody that's just not sure, cool. Have them see a physical therapist or do something else. It's up to them. You can't like enforce your approach to healthcare to others if they're not willing to do it. That's what I will say with that. I'll tell you one of a really interesting case, which I think people need to know about as well. I had a patient who, it was probably my third or fourth week as a chiropractor, and she couldn't hear out of her left ear. And she went to the best doctors in the university, and she saw these specialists, and they did MRIs, and they did all these exams, and no one could figure it out. And she went to this top ENT specialist, and blah, 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 and no one knows, and what can you do, and blah, blah, blah. I was fresh out of school, so like, okay, these guys all did this. So like, what are you gonna do? So I had like my otoscope, and I just looked in the ear, and there was just a huge whack of huge wad of earwax in her ear. I'm like, okay, cool. Has anybody ever looked in the ear? She's like, no, that's kind of weird. That's like really weird. Nobody ever looked in my ear. But they're like specialists, like, I was like, all right, well, cool. So we have like ear candles. They're like these things, and it's the best I had, And so I did that, and I melted the earwax, and lo and behold, she here, crazy. She leaves. I was taking over a guy's practice at the time, and the receptionist was like, "Oh my gosh, did you see her insurance? She had the best insurance. We should get her back in." I was like, "She doesn't need to come back in." But then I was thinking about it. I think what was happening was she had like amazing insurance, and I think people were just taking advantage of that, which is horrible. And so she was getting MRIs and specialists, but it's weird that nobody was able to like look in their ear. And so one of the things I would recommend is if you do have patients with really good insurance, or patients that are like somewhat wealthy, or I would say more insurance, if they have something that's never getting better and they're constantly seeing all these specialists and stuff, I mean, a lot of these guys are good, but there are going to be bad ones. I would say get a second opinion and do it cash and see if they add up. And if they don't add up, then that's like a legal issue, or that's like a real issue. If they do add up, fine. But I've seen that maybe a few times where it would be like somebody that's really well off, and they have really good insurance that covers 100%, and they've had the most chain of doctors for issues that they might not have needed. So that's just an interesting side note. I would just say, if that's what I recommend to some people that have really good insurance that have issues that have never gotten resolved, is see somebody else and just say it's cash and see if the diagnosis is set up. Okay. How do you know you wanted to specialize in non-invasive spine health as opposed to neuro or orthosurgery? What are the steps to being a chiropractor? Yeah, I mean, a lot of these things could be avoided. Medications has its place, and so is surgery, but a lot of people get unnecessary surgeries. And I think with the whole opioid thing, the majority of people come in for low back pain or get onto these opioids because of back pain. And I think it was like a very high percentage. I don't know off the top of my head, but I think it was like 70 or 80% never saw a chiropractor. So they just saw a doctor for low back pain, got addicted to pain meds, and either went down that dark road or had a whole road to get back off of the pain meds when they could have just gotten an adjustment. And the body's always trying to heal itself. I mean, you have an immune system, and sometimes when the nerves get impinged or things are blocked, body has a harder time healing itself. So if you can unblock them, then you'll have a better shot of improving. And if you don't heal, the body doesn't heal itself, then cool. Then look at other avenues. But I personally believe it's better to be more conservative and effective, if you're good, than to just cut into the spine. And sometimes when you fuse the spine, the motions are different. Or sometimes what happens if the surgery they didn't need. Now they're in a worse situation. So I always approach it, be more conservative first, and then if that doesn't work, then go the other way. Now there are times where somebody needs surgery instead of seeing me. If a guy gets shot, I'm not going to be able to adjust the bullet out of him. Like, get that taken care of. But you'll see a lot of in betweens, and chiropractors might be the right person. Okay, cool. What type of pain do chiropractors? We do all sorts of stuff. And when should I consider going to a chiropractor? Are self adjustments recommended? No, self adjustments are not recommended. I just had somebody adjust themselves and go to the ER and then come see me today. Don't do it yourself. Most likely, you probably won't cause a problem, but there's a chance you could. It's just a skill. You just need to know how to do it. I don't adjust myself. I have a chiropractor and I get adjusted like once a week. And we just adjust each other. So I don't do it on myself, and I wouldn't recommend it. A lot of times people crack their neck. That's not an adjustment. That's just, it can be ligament laxity. That could be a bunch of things. When the body gets stressed out, sometimes ligaments get loose. So if you're not getting enough sleep and things like that, or you're overstressed because of school, it's possible it's easier for you to crack yourself. That's not a real adjustment. That's just a sound effect that comes from your spine. We treat all sorts of pain. I've treated neck pain, headaches, shoulders, elbows, anything and everything. Chiropractors initially, we're trained in a lot. We became known as the back doctors because insurance would pay for just back adjustments. That's kind of where that went. But we can look at the whole body. We just don't do drugs and surgery. That's it. We don't puncture the skin. But we do a lot of different things. Yeah, if you're curious, go see a chiropractor. If you're in pain, just go check one out and see if they're good. Make sure they have good reviews. Like anything, you're gonna have good doctors and bad doctors. Get a feel for the guy first or the girl. And just see if it's the right fit. If you're in pain, go for it. If you want to just feel better, go for it. That's what I recommend. Cool. Okay. Challenging questions. Most challenging part. I think we talked about that. Common diseases. Yeah, adjustments, they help with all sorts of things. So it can be pain, it can be some internal things. I've seen some neurological cases improve, stuff like that. I talked about this one. Yeah, so how is the path of becoming a chiropractor similar, different from the path of becoming an MD or DO? Chiropractic school is way easier to get into, but a very similar curriculum, believe it or not. We get more anatomy, we have more, I believe, nutrition, but I still have to do like histology and pharmacology and stuff. Medical doctors get more of that. DOs were very similar to chiropractors, and then there was a time, sometime last century, where DOs got offered to have the same status as an MD and be able to prescribe. I think chiropractors were more stubborn and didn't want to prescribe meds. But DOs are pretty similar. It's just a little bit different. But education-wise, it's pretty brutal. There's 4 chiropractic board exams that come twice a year. They're very expensive. They don't have a lot of people fail them. And then there's a physical therapy one. And so you have to do your basic sciences and then adjustment, like theories and x-rays and MRIs and all that stuff. I don't think you do the adjustment. You pretty much mock it up when you do the boards, but they film you. Like you'll go into, like on my part 4, I remember, like you go into a room with an actor and an actress, and you have to get the right diagnosis, and it's a whole role play. And like you have to, did you hand sanitize? Did you do that? Like it's a whole thing. So it's pretty hardcore. Yeah. Okay. What advice you have for young physicians, and what's the hardest part of your job? Sometimes just being respected, I think, as a young doctor, just getting in there. But if you can be a community leader, like get involved with your community as a young doctor, and just help people. Just help people all the time. Get involved with charities, and do things not just for your own benefit, but for others, and they'll come see you. And you'll find that there's certain adults that will give you a chance, and they're really cool. Like I remember I had an accountant, I had a lawyer, I had a jeweler that all took risks on me as a young doctor, and because they knew what it was like starting out young, and they helped. So there are people out there. First part about my job, um, yeah, I don't know. I love my job. I think sometimes they'll get like people that are just so stressed out and they put a lot of pressure on you. Because you take on their emotions. So, like if someone's coming to you crying or panicking or like whatever, like even if you help them, um, that still stays with you. So you just have to find other outlets of enjoyment, like going out and working out and stuff like that. But most of my patients do get better or we refer out. But I think sometimes the hardest part are just more difficult patients. Okay, similar to PA school, do chiropractors need patient care experience before they apply to being a chiropractor? I don't know, different schools are in different states. And so they have each different chiropractic school has different rules. Um, I don't know what it is now. When I was doing it, we needed the basic sciences and we would intern and we needed recommendations from other healthcare professionals. Um, I think I started chiropractic school in 2009, and so it's 2021. So I have no idea. I don't know what the rules are now. Sorry. Yeah, do chiropractors work with PAs? Yeah, we work with everybody. It works good when you have friends. If you have friends in other professions, because sometimes there's certain things that you could do that other people can't, and sometimes there's things they're really good at you can't do. Like there's a place down the road that it's a PT office that's for pelvic floor. So vaginal pelvic floor issues and things like that, or like tailbone. And I know how to do it. It's something I probably just don't want to do. So we refer out, and they'll refer people to me. Be friends with everybody, and be friends with people in your profession too. Don't look at it as like a competition. I get patients from other chiropractors. I refer out to other chiropractors. I'll do like a few personal injury things, but it's just not what I like to do. So when they come in, I just send them out, and then if somebody has something that I do, they refer. It's better just to be friends with other people instead of it being like a competition. There's so many people on the planet. Like at the end of the day, it's not that big of a deal. What's the difference between spinal manipulation and adjustment? Chiropractors like the word adjustment, and sometimes people like the word spinal manipulation, like billing. Billing codes like the word spinal manipulation. It's the same thing. It's just our nomenclature. We like the word adjustments, but it's the same thing. There's no difference. How has technology changed your job? There's cool stuff. There's spinal scanners. There's equipment that do soft adjustments. There's tables that do adjustments. There's technology is awesome. You just need to use it. I think being a chiropractor is a profession that I don't think AI is going to take over. I know some people are worried that AI might replace certain types of doctors or X-ray techs and stuff like that. Unless there's a robot that people feel trust, like unless they trust a robot to adjust them, which I don't think they will. I don't think we're going to go away. So yeah. How do you adapt to different kinds of patients? You just do. I mean, it's better to be flexible with what people are comfortable with as opposed to just doing one thing only. There is a stereotype. There are certain doctors that use something called what's called the flying 5 or the flying 7, which is just it's 2 neck adjustments, a mid back adjustment, 2 low back adjustments, and 2 sacroiliac joints. I wouldn't recommend that. Just do your due diligence and find out where they need to be adjusted and adjust those. Yeah, just be good at what you do and love what you do. I think that's kind of like the most important thing. Cool. So I think I went through all those questions. Thanks so much for having me. Is there anything else, you guys? Any other questions? Cool. Well, yeah, feel free to follow me on social media. And if you have any other questions, just let me know. You guys can always DM me or email me or something like that. I'm always here to help.
Thank you so much. I've definitely learned a lot from your session. I think one of the biggest things I really liked is not just the case studies, but also the more like, I guess, just how to talk to patients and how to deal with different kinds of patients, as well as having range as a doctor or a medical health professional, not just kind of having that tunnel vision, like saying, oh, only do these two things, or like the example that you gave us. I think a lot of times we kind of miss that as like pre-health majors, where like, oh, why do I have to take this class? I don't see myself doing anything in like nutrition or some
Right.
other class. It's like, well, how is this ever going to help me? But I guess like, after like you mentioned how sometimes patients don't see other doctors and they're kind of just come to you, I think that really put a whole different perspective on how I look at my classes now going forward as well.
100%. Yeah. It happens. And, I didn't know that until after I became a doctor. You know?
Yeah. Well, thank you so much. I'm so happy to have you on our channel and everybody else who's watching. The Google Forms link has been posted, and please finish that by 8:45 Eastern time. Thank you so much
Thanks for
and
having
have a
me.
good day. Bye.